When we are growing up, see, normally whenever a person, let's just say we have a baby who is born, for the first 1 year, it is the baby's IGF-1, insulin-like growth factor 1, and insulin, in fact, which is going to be important for the baby's height. From year 1 till the start of puberty, it is the growth hormone. The growth hormone is the hormone which is important for the height of your child. So we have various charts. At every year, we have a chart which is going to tell us at this year, where are we standing? Are we standing within the 3rd to the 97th centile of our population? That is, are we there at least in the population averages, or are we falling way below? So ideally, whenever you take your child to a pediatrician, just get his height evaluated, get it evaluated, because you need to know how the height is of your child. So till puberty is just the growth hormone and your thyroid hormone also, which is important, letting the growth hormone work well. And then after puberty, we have estrogen, which increases the growth hormone activity. Like growth hormone acts on the liver, produces IGF-1. It's not something which is important for you to know, but what you need to understand is our sex hormones, estrogen particularly, it increases your growth hormone and IGF-1 activity at the level of the bone and increases the height. It also improves the osteoblast, the bone cells, which is important in increasing the height and prevents osteoclast. The one thing here is estrogen also fuses your bones. So by fusion, what we are talking about is, let's just say we have this bone, we increase in height basically because of the increase in our legs. Because we are not quadrupeds, because we are bipeds, because we just stand on our feet, it is the increase in the size of legs which is leading to your height increase. So normally what happens is, let's just say we have a bone here and a joint here. So this bone, there is always a little bit of a gap, and in this gap, new bone is getting added. So what estrogen also does is, while it increases the bone addition, it fuses this bone too. So if a patient is having more of estrogen, which is what I am saying, if a patient is having precocious puberty, there is going to be fusion of the bones and the height will not increase after that. 97% of the people, in fact, don't increase their height after their menarche. So from the time the person is getting a menses, by that time, very likely the bones must have been fused. That is something which we need to understand, which is a very important thing for our population. Basically, the changes in the body parts, as I said, facial hair is a very important thing. So if a person is not getting facial hair and if a patient is not even getting pubertal hair, definitely go and see a doctor, because that has to be there. In the male, there is an increase in Adam's apple and the voice gets changed. So that is what the change in voice you see between a child and between an adult. The changing in the voice is because of the change in vocal cord, which is seen because of the male hormones. So similarly, these are some of the changes which we see, the muscularity in the male and more of the femininity in the female. All of these things are seen because of the puberty, along with the changes in the breast, changes in the testes, changes in the internal genitalia too, the external genitalia too.